If you want to give another brief little intro about yourself there, you can.
Sure. So, my name is Dr. Frank Aieta. I'm a naturopathic physician here in West Hartford, Connecticut. I've been in practice for going on my 24th year, and I treat everything from A to Z, from allergies to asthma all the way up to autoimmune diseases and cancer. So I've been using the KBMO fit test for probably well over 10 years now. So I'm pretty well versed in it. I try to run it on most of my patients. We'll talk about which kind of cases I definitely run it with as we get into the slideshow here. But I have a really, really nice case study for you today. Kind of exemplifies a bunch of different things from a weight loss perspective. It discusses some autoimmune stuff, gut barrier. So it really is an encompassing case. That's why I chose it. But so let's get down to business. I got a little housekeeping stuff that I want to go through, some KBMO stuff, and then we'll get into my case study. I'm definitely going to go through just kind of the aspects of the test, just kind of a brief overview of the FIT test, the food inflammation test. So first off, want everyone to know that you can go to sign up to get an account. You can go to the website here. When you sign up, you can put in the code for a discount. You mentioned the code for a discount. You'll get a FIT 176 test, which does 176 different foods and food additives. And it also contains the gut barrier test. Regularly $395. We have it discounted for 200. And so basically, KBMO will email you a new account form, fill it out, email it, scan it, and send it back to KBMO, and you're registered. And then the kits will be sent out to you, and then you can perform it. They're easy. It's a finger stick test. I do them right in the office. 5 drops of blood, put it on the little card. It comes with a prepaid UPS bag. Very, very simple. I send out dozens of them a day, so really easy. Okay, let's go to the next one. So, in today's discussion, we're basically going to be discussing the whole concept of food sensitivities, inflammation and gut permeability, and this is all in one test. We're going to kind of go through, we're going to give you a little overview of food sensitivities and compare and contrast it to the typical food allergies, the immediate sensitivity reaction, IgE. We're going to compare that to the food sensitivities. And also we're going to touch on food intolerances. So 3 different animals, we have to address all 3, kind of look at them. And today we're obviously going to be focusing very heavily on food sensitivities. Okay, so here's the definition. So food allergy, immunologic IgE mediated reactivity. Think like a peanut allergy, okay? Immediate response reaction usually affects 3 areas of the body: the skin, respiratory tract, and digestive tract. Most of your patients are going to know if they have food allergies. They come in and say, "Can't have peanuts, can't have this, can't have that." They'll already know. Um, I will check through. I will check IgE related allergies. I usually use Quest Diagnostics if we're trying to uncover an immediate reaction food allergy. But what we're talking about more is the food sensitivity, which is more of a delayed or cumulative response to food. Meaning you could eat something in the morning, feel perfectly fine. An hour later, 4 to 5 hours later, 3 days later, you can get a reaction anywhere in the body. Okay. So, and then we have our food intolerances. This is more of a non-immunological reaction to food. Think like a lactose intolerance, fructose intolerance, histamine intolerance. So it's essentially when you're eating foods that your body can't break down due to lack of certain enzymes, due to gut barrier dysfunction and whatnot. And those food intolerances could be immediate or they can also be kind of delayed. So differentiating between a food sensitivity and a food intolerance, this is where this test kind of shines, in my opinion. Okay, let's go through, the whole process here. So we're going to dive into kind of some leaky gut talk here. So when I explain this test to patients, I explain to them, okay, we're talking about food sensitivities. You put a food in your mouth, you start chewing it. First stage of digestion happens in the mouth. You're breaking down your food, it goes into your stomach. stomach acid are secreted. You're breaking the food down further. The whole process of digestion essentially is to break the food down to its smallest little parts. Proteins to amino acids, fats to fatty acids, and carbohydrates to glucose. And as it works its way through your digestive tract, you're going to hit an area where absorption occurs, and that's in the lower part of the small intestine. And in that area of the small intestine, we have a very selective barrier, as you can see in the little picture here. Kind of gives you a little graphical representation here. Very tight gap junctions between the cells. Now, over time, that barrier can get broken down. It can get a little bit more permeable due to poor diet, due to antibiotics, due to medications, due to bacterial overgrowth. There can be a candida yeast overgrowth can cause damage to that intestinal barrier. So let's say you eat some eggs for breakfast, and the eggs are broken down. They're working their way through your digestive tract, and based upon your transit time, how well everything's moving through your digestive tract will probably yield when your reaction to certain foods is going to occur. If you have a very slow digestive tract, you may not see symptoms pop up for a day or two, because it's all about that integrity of that gut lining. I tell patients, you got this egg protein coming down through, or any other type of undigested food particle gets down to the small intestine. If that barrier is leaky, that protein is going to slip through the cracks. It's going to get into the bloodstream. The body's going to say, "What is that? That's not supposed to be here." And you're going to start mounting an immunological response against it, and ultimately an inflammatory response. So the nice thing about this particular test, the food inflammation test, which we'll talk about in a minute, it does two aspects of it. It will look at the IgG related immunological response, and it looks at complement, which represents more the inflammatory response, and we look at both of those. So we get a much more sensitive test over a lot of the other tests that are out there that are doing just IgG alone. Okay, so when do providers use the fit test? Well, in my practice, I try to run it on almost everyone, because I think everyone should know if on a daily basis they're eating a food that's causing them discomfort or causing them potential problems. And sometimes, we'll run it, and sometimes patients will come in, and I'll kind of go through it, and they'll say, "Well, yeah, it'd be nice to know." And then we run it, and we see us, they may say, "Okay, I'll run it. I don't have much going on." We run it. I show them what the foods are. We take them off the foods, and lo and behold, all these little nagging symptoms that they didn't even realize they had, they go away. So, going through, obviously, someone struggling to lose weight, if you're eating foods that are inflammatory, that are causing an immunological response, yes, it's going to have an impact on ability to lose weight. Definitely every single autoimmune case, I will run a fit test on them, hands down, because I feel that, an autoimmune disease is almost like a further progression of a food sensitivity in susceptible patients. So someone can have a food sensitivity. They're not going to automatically develop an autoimmune disease, but given a genetic profile, this can manifest in certain patients. So definitely autoimmune diseases, migraine headaches. I've gotten good results with patients eliminating certain foods, getting rid of their migraines. Thyroid problems. Actually, today's case is an autoimmune thyroiditis case that we're gonna talk about. Arthritis cases. I've seen this hands down. Food sensitivities can impact joints and inflammatory responses in the body. Brain fog, fatigue. I mean, the list is endless. I would say for basically any type of condition, this test is definitely warranted. Okay. All right. So why providers use the test? Well, the immune complex issue and inflammation that can be associated with foods are an underlying problem for all the conditions I see on a daily basis, just like we went through. So we can kind of correlate a lot of disease processes to this immunological response, and also the inflammatory response. So when a patient comes in to see me and they have an autoimmune disease, I say, well, we need to see what's driving this autoimmune process. We can go the conventional route and suppress the immune system with biologic drugs or steroids or whatnot, or we can kind of get a little deeper and see what's driving it. It could be, in other cases, it could be a bacterial infection that's persistent. It could be a viral infection, but the foods always are at the top of my list. And you'll see with today's case how powerful, just simply eliminating certain foods from the diet will have on the production of autoantibodies in the body. So this slide kind of shows the two aspects. We have the IgG related reaction, and then we have the complement, which kind of designates the more inflammatory component. So this test kind of encompasses both aspects. Just a little breakdown here. There's 3 tests available. Um, One is the 176 foods. So 176 foods and food additives, which also comes with the gut barrier panel, which will look at candida, which is pathogenic yeast overgrowth that can further exacerbate a permeable gut barrier, leaky gut, zonulin, occludin, and LPS. The 132, that's the one that I typically run on most patients, kind of the middle of the road one. If people want to, I give them the option between these two, the 176 and the 132. And then we have a short, kind of a condensed version, which is the 22 foods. Does not contain the gut barrier panel. Relatively inexpensive, kind of a nice one for people that are on a budget, or I find that, people that, may not have a lot of stuff going on, have more of a limited diet, and it kind of just does the big 22 foods, okay? And when you kind of look into it, you can, when you sign up for an account and so forth, you'll be able to see what foods are in each one of the tests, and you can kind of pick and choose accordingly. Okay, this kind of just a sample report. I believe this is a Fit 132 sample report. As you can see, this is like the second page. It kind of gives you a nice graphical representation based on the reactivity of the food in the body, based on a scale of 0 to 4. The 4s and 3s are the big ones that you want to take out of the person's diet immediately. Try to have them not cheat for a period of time. The +2s, those are lower on the totem pole. A lot of times I'll tell patients, listen, you can eat these foods, kind of limit them to maybe once or twice a week, but definitely pay attention to how you feel after eating them, in particular, within the next day or two after eating them. So a lot of times we'll do that. Okay. And then there also is a portion, these are the additives, the food additives. You can see all the coloring agents and so forth. So kind of nice, kind of unique to this test. Most other tests are not really looking at this. That's one of the main reasons that I really like it too, is because it does look at these colorings and additives and so forth. Okay, let's see. Oh, okay. So when you do a test on a patient, the patient will receive a customized diet plan specific to their individual food sensitivities. So really, really nice. Kind of takes the guesswork out of, okay, what do I eat now? So it kind of gives you a basic, breakdown by, day, breakfast, lunch, and dinner, snacks, and so forth. So kind of cool. Um, let's see. The patient will also be able to get their results and their food plan through a phone app. Okay, so when they're filling out the paperwork, when you're filling out the paperwork, you can just put the patient's email address in there. They'll get a link to download the app, and then with all their information, with all their testing on there. So pretty cool. So they have it with them all the time. They can just pop it out when they're out at a restaurant or whatever, and they can kind of refresh their memory on what foods they really want to stay away from. Okay, so let's get into my case study. Okay, so once again, Dr. Frank Aieta, naturopathic physician, and I'm going to go through a really cool case study. I think you guys are going to really like it. So this is the patient. Let's go through. So the patient is a 35-year-old female presenting to my office 9 months post-pregnancy with the following complaints. Number one, difficulty losing pregnancy weight despite proper diet and exercise. She claims she needs to lose about 30 pounds to reach her ideal pre-pregnancy weight. She has significant amounts of fatigue, worse as the day goes on. She claims that she just has poor endurance. She can only get so much done during the day, and having a young baby, it makes it even harder. Constipation, coupled with a lot of gas and extreme bloating after most meals. She's complaining of more dry, rough, bumpy skin. She's complaining of cold intolerance and some mild dysthymia, postpartum type of depression issues. Okay, so let's see what we did. So before I did anything, I always run conventional blood work, and these are kind of I run very extensive blood work on most of my patients. These were kind of the big highlights. There was other things, but for this particular presentation, I just kind of listed the most blaring things. So obviously, TSH levels came back elevated at 7.05. I like to see more of an optimal range of 0.27 to 1.5, more in that lower range. I also run uh, other thyroid tests. I run a T3 free, T4 free, reverse T3. Um, all of those were a little bit on the low side. The reverse T3 was a little elevated, telling me there was a little bit of thyroid resistance kind of going on there. Run a thyroid antibody panel. I try to do this on every patient because you never know what you're going to find. So thyroid antibodies, someone can have a normal TSH but have a raging autoimmune issue going on in the background that's attacking the thyroid, and you just kind of caught them on a day where their TSH popped up pretty normally. And a lot of doctors will miss this. The person comes in with a slew of symptoms that pertain to, to thyroid, but the doctor may overlook it because the TSH falls within that very broad category of that the conventional labs will use of zero point 0.4 to 4.5. That's the typical range for most laboratories. And we know that, that range is based upon more statistical ranges. They take the population of people that have gone to the lab, they find the mean, they go 2 standard deviations to the right, 2 to the left, they make their bell-shaped curve, and they say, if you fall within this range, you're normal, in contrast to people in your age demographic and whatnot. Well, in my opinion, I don't like to compare my patients to a population of sick people. So we try to condense those reference ranges and obviously run a little bit more in depth. So with this patient, we saw that the antithyroglobulin antibodies, optimal range was less than 1. Hers showed up at 80. The thyroid peroxidase antibodies, optimal range less than 9. Hers was at 150. Okay, this is common. I see a lot of autoimmunity spark off post-pregnancy, and we'll talk about some of the reasons why as we get along. I checked her ferritin level. I also checked her serum iron levels, which were low, but wanted to highlight the ferritin, which is her storage form of iron. Her level is only 10. Now, optimal range for kind of a menstruating woman is between 30 and 50. More postmenopausal women, we like to see it a little bit higher. They're not losing blood every month. So a patient is actually faithfully taking 325 milligrams of ferrous sulfate BID as prescribed by her OBGYN. So she's taking a boatload of iron, probably contributing to some of her constipation issues, but she's not absorbing it. I mean, her ferritin's not budging. And she's been doing this for several months. So my working diagnosis obviously is Hashimoto's thyroiditis, presence of 2 antibodies, iron deficiency anemia, IBS with constipation, some dysthymia postpartum, and definitely some fatigue. So we ran a fit test. Okay, we ran a 132, and the test came back. Takes about 10 days to get the results back. So 10 days later, I got these results. And we see that right at the top of the list, wheat gluten and whole wheat. Pretty blaring. Middle of the road was cashews. Low on the list was egg whites, rye, sweet potatoes, turmeric, and clams. Now, the gut barrier, as you can see, very positive for candida overgrowth. Zonulin, occludin, LPS, these are all confirmatory of weak, tight junctions, leaky gut barrier dysfunction there. So what did we do? Obviously, we put her on a wheat/gluten-free diet. Had her avoid cashews, and I had her limit egg whites, sweet potatoes, turmeric, and clams to no more than 1 to 2 times a week. Total elimination of rye because it is a gluten-containing grain. And we changed her diet up. I had her stick more with a low carb diet. I do this with most of my patients, in particular the starchy carbs. I had to really bring down to around 50 to 75 grams of starchy carbs per day. Do not exceed 25 grams per meal. Those include things like bread, pasta, cereal, rice, corn, potatoes, fruits, beans, legumes, um, alcohol, chocolate, desserts, all those types of things. Those are more the starchy carbs. So I didn't say stop them altogether, unless the ones that popped up on the food sensitivity test, but definitely cut back, okay, and focus more heavily on protein at each meal, good dietary fats, olive oil, coconut oil, avocado oil, grass-fed butter, things of that nature. And then also her carbs, I said that she should really get most of her carbs from her vegetable sources, non-starchy vegetables, maybe 2 to 3 non-starchy vegetables per meal. So let's see how things progressed. So we also, at that visit, after going through the food sensitivity test, I recommended a dietary supplement. And this is one that I actually formulated several years back, and I've had great success with it, treating candida and also dysbiosis, overgrowth in the digestive tract. This is my candida control complex. As you can see, we have the usual suspects in there. We have the oil of oregano, caprylic acid. We have some enzymes in there to kind of help break down any biofilms that may be developing. There's a little spore probiotic in there. So really nice product. So we started her on that immediately. I also started her on my Hashimoto's product. I designed this product several years back because of the notoriously high amount of cases of Hashimoto's that I was seeing in my practice, because I screen for it. And I see it a lot of times. It's more prevalent in women, and we'll get into that a little bit more as we go along. And as you can see, it contains a lot of different ingredients: selenium, black cumin seed oil, cordyceps, inositol, NAC. All of the ingredients were put in here for a specific reason: to downregulate the autoimmune response. Selenium, also in conjunction with inositol, has been shown in the research to reduce autoantibodies to the thyroid. The herb ashwagandha works really great at improving the conversion process from T4 to T3 in the body. Curcumin. Now, curcumin is derived from turmeric. And remember, turmeric was on her list, but it was a +2. But this is the extract. This is curcumin. So you're not really getting a lot of the aspects of the turmeric in there. So I said, you know what? The product is so powerful and so useful. I'm gonna keep her on it, even though turmeric showed up low on the list, but we decided to use it anyway. I made a judgment call, and it did pan out. So I also I switched her iron supplement. I got her off of that ferrous sulfate, the stuff that wasn't absorbing. And I put her on a nice, highly absorbable form of bisglycinate, iron bisglycinate, a chelated form. It also contains some methylated folic acid and also some methylcobalamin in there. And so I put her on that, took her off the other iron pill, and just to kind of get her levels up a little bit. And so the patient was sent away for 6 weeks to work on her diet and start her new supplement protocol. Okay, 6 weeks goes by, and the patient comes back, and the patient reports significant improvement in constipation, as well as gas and bloating, bowel movement now daily, kind of good. She was happy about that. Energy levels had improved, much more endurance, less of a crash later in the day. She said, I'm able to stay up past 8 o'clock at night. Well, that's a good thing. Improved tolerance to cold. Her skin seems to be less dry overall. And she was super happy about this part, was able to lose 12 pounds in 6 weeks with minimal effort following the dietary restrictions. And she decided to keep her carbs closer, her starchy carb intake closer to the 50 grams per day. Overall improvement in mood and motivation. So She also, once she started getting more energy, she was able to do more walking and so forth. I really encouraged, I said, listen, when you get to a point where you're more motivated, you have the energy, 5 to 10 minutes brisk walking post meal, excellent. So she started incorporating that as well. So that worked out great for her. So my plan was I wanted to kind of give it a little bit more time before I repeated any blood testing. So patients retest labs in an additional 2.5 months to monitor thyroid and iron levels and repeat gut barrier tests. I'm not going to rerun the entire food sensitivity test, but I did want to run the gut barrier test just to see kind of what's going on if my treatments were working properly. I had her continue previous supplements with modifications to the dosages. I reduced some of them due to improvement in symptom picture. Had her continue with the diet modifications, keeping her daily total intake of carbs around that 50 grams or less to continue with her weight loss journey. New additional supplements were added to address the intestinal permeability, the leaky gut component based upon the new gut barrier panel. Okay, so you can't really read the ingredients too much here, but I have a product that I put together. It's called my Optimum Gut Health Powder, and it's like throwing the kitchen sink at someone. It's in a powder form. If it was in a capsule form, this person would be probably consuming 10 capsules or more a day. So the powder is just a little bit more convenient. Contains a little colostrum in there. Has all the different nutrients that will help heal and seal the digestive tract, some leaky gut support, some zinc carnosine, glutathione, glutamine was in there. We have some fiber supplements, it's fiber in there, some slippery elm root in there, marshmallow extract, things just to kind of soothe and heal the gut, some enzymes. So kind of a well-rounded product. I like to use that with patients in the final stages where we're healing up their gut. And then I added in a product I call leaky gut repair capsules. This is kind of a patented product. It contains serum bovine immunoglobulins, so immunoglobulins G, IgGs. These work really good, especially I have patients take this with meals just in case if they do screw up with their diet. The nice thing about this is that these IgG antibodies that are produced that are in this serum bovine immunoglobulin, if the person has any endotoxins, bacterial endotoxins in the gut, undigested food particles, this will form a complex and it will prevent the crossing of that food particle across the intestinal membrane. So it's a large complex, so too large to cross that intestinal barrier there. So it just kind of gets eliminated through the bowels. Really nice product. I use that with most patients if I see that dysfunction in their gut barrier. Okay, 3 month follow-up. So the patient was able to reach her ideal weight over the 3 months leading up to our visit. Total weight loss in the 4.5 months since we started was a little over 30 pounds. She hit it. Energy level is back to normal pre-pregnancy. Digestion is good. Normal form bowel movement every day. No major gas or bloating, unless, of course, she overdoes her sugar and carbs. That'll feed a little bit of that yeast, or if she cheats on her diet by eating too much wheat or gluten-containing foods. Body temperature a little bit more stable. Further improvement noticed with her mood and motivation. Overall, patient is very happy with how she feels and her ability to lose weight and the resolution of all her other presenting symptoms. So, success. So we did a 3 month follow-up of her labs. We looked at, and this was pretty amazing. We just, her original TSH was 7.05, 3 month follow-up, 1.34. And now we didn't put her on any thyroid replacement here. We didn't do any Synthroid, any Armor Thyroid. We didn't do anything. We basically just worked on her gut. We gave her the Hashimoto's product that has all those accessory nutrients. And as you can see, her thyroid antibodies dropped significantly. And this is common. I see this all the time, big drops. And so, these levels of 80 and 150 were not extremely high either. I see levels in the thousands with certain people. So we nipped this kind of early on. So her levels went from 80 down to 20, 150 down to 60, and lo and behold, her iron levels her ferritin went from 10 to 54. Now she's absorbing stuff again. Okay. So that's a good thing. We repeated the gut barrier test, the original test, as you can see on the left, at all the red. 3-month retest. Candida antibodies were more of the IgG ones. The more acute ones, the IgA, the surface antibodies, those came back negative. Um, Pretty good healing effect here. The zonulin, a little bit positive still there, but in the IgG form. So significant improvement in overall gut barrier and reduction in candida overgrowth. So based upon the repeat blood tests, we decided to continue the candida control supplement, the Hashimoto's thyroid support, both with modified dosages. Stop the iron supplement for now. I said when you start getting a menstrual cycle, if it is heavy, we can always add it back in a little bit and see how you do. We would periodically be retesting her anyway down the road. Continue with the diet with slight modification in carbohydrate intake, but still kind of keep it between that 50 and 75 grams of total starchy carbs per day to maintain her weight and prevent further candida overgrowth. We don't want her to start, eating tremendous amounts of sugar and carbs to feed that yeast that we work so hard to get rid of. And then continue both the gut health powder and the leaky gut support capsules at a reduced dosage. And definitely the leaky gut repair caps. I said definitely take those if you're gonna cheat any at all. So make sure you're taking that with meals that you're a little suspect if you go out to eat. If you're eating at someone's house and you can't really dial it in what's in the food, definitely take that. It will minimize your reaction to that food. Okay, additional support at this point. We cleaned the slate. We started healing the gut. And we want to put in some probiotics. So I like to use a multi-strain probiotics to reestablish normal gut flora. So this is kind of a well-rounded product. Also contains a little bit of prebiotic fiber in there. So has all the lactobacillus bifidobacter. I believe it's 40 billion organisms per capsule. So let's go and see. So now, whole goal here was, we identified the food sensitivities and gut barrier integrity and candida overgrowth, and they're critical to diet and supplement plans for patients. So it kind of gives you as you saw, gives you an idea of where to go with your treatments. It gives you a place to go. I'm trying to move this out of the way here. Bear with me a minute. Just shrinking this down. Okay. So the patient had a clear autoimmune disease affecting her thyroid with the presence of 2 types of thyroid autoantibodies, antithyroglobulin and thyroid peroxidase. Wheat and gluten were the 2 biggest culprits that led to a breakdown in her gut barrier, as seen on the gut barrier test. So just some clinical pearls and conclusions based on, Hashimoto's and iodine deficiency. So Hashimoto's thyroiditis is one of the most common autoimmune diseases that I see in my practice. It affects women more frequently than men and carries a genetic predisposition. Usually, someone has it, their mother may have it, their sister may have it, their aunt may have it, their grandmother may have it. I found that close to 70% of the patients that I see in my practice that come in already with a diagnosis of hypothyroidism will test positive for thyroid antibodies as a causative factor. So, I say to these patients, yes, you have a thyroid condition, but you first and foremost have an autoimmune disease. So just treating the thyroid condition with a thyroid replacement in many cases is not good enough. We want to tame down that autoimmune response in the background, because in all actuality, let's say, the person's producing this much thyroid hormone and the doctor gives them this much more. Well, they're basing that on their TSH values, and maybe they'll run a T4 level. But if they have this autoimmune process that's waxing and waning based upon a variety of different factors, based upon their diet and so forth, and how reactive their body is to those foods, one day they'll be making this much thyroid hormone, next day they'll be making this much, next day they'll be making this much. So there's a lot of inconsistencies that I find in how people feel unless we address the autoimmune component in the background. I found that, just treating the thyroid with replacement is not good enough for most of these people. They still have a lot of the clinical signs and symptoms. They say that their symptoms tend to wax and wane. Now, during puberty and pregnancy, there's an increased need for the trace mineral iodine. For breast development at puberty, an increased need of iodine for the developing fetus during pregnancy. Couple the iodine deficiency with a genetic predisposition, and autoimmune conditions can develop. So little conclusion here, I find that gluten can be a strong driving factor behind the body's overproduction of thyroid antibodies, especially when there is intestinal permeability, obviously. The gluten and the other wheat proteins will cross the digestive barrier intact and cause the body to produce antibodies to the gluten protein, which in a genetically susceptible person can lead to an uptick in thyroid autoantibodies through a process known as molecular mimicry, where the same antibodies being generated against the gluten and other wheat proteins will cross-react and attack similar structured proteins that comprise or help form thyroid hormones. So, some more clinical pearls and conclusions. Food elimination assists digestion and absorption. So in this case, also showed how eliminating sensitive foods which are disrupting digestion and absorption can improve nutrient absorption, which in this case was iron, as well as other nutrients needed to regulate normal immune function, such as the trace mineral selenium found in my Hashimoto's product. Selenium can be shown in the research to significantly reduce thyroid antibodies, which was obviously seen in this particular case. Now, let's do a little compare and contrast. I kind of alluded to this already, conventional approach versus naturopathic or more functional medicine approach. If this patient had presented her case to a conventionally trained physician, she more than likely would have been placed on a thyroid replacement hormone like Synthroid to be kept on for the rest of her life. Her low mood would have been most likely chalked up to postpartum depression, and an antidepressant medication may be prescribed to be taken indefinitely. Her constipation, intestinal gas would be treated with a laxative or stool softener and an anti-gas medication. Her dry, rough, bumpy skin would have been most likely treated with a topical moisturizer. In regards to her inability to lose weight, her doctor would probably recommend the typical eat less and exercise more prescription. So once again, I'm going to show this slide again. If you want to, sign up for an account, use the code there, follow the link, and fill out the form, and you're good to go. So that's my case. Any
Awesome.
any questions about any of that?
Yeah, it looks like there's some questions in the chat. April is asking, can you explain the IgA1 column versus the CD3 complement? And are there other tests that are check IgE or IgG checking the IgA1 to 2? She said she used a different company for complement and found she's like 10,000 times more sensitive to sesame than would have been seen on IgG only.
Well, that's what
Um,
this does. Yeah, this test looks at that. The complement component kind of represents the inflammatory response. The IgG. So when a molecule and a protein molecule enters into the bloodstream, obviously the first line of defense is the production of IgM antibodies, which then convert over to those IgG antibodies, and then the activation of the complement factor, which represents the inflammatory component. Now, the IgA is kind of those surface antibodies, the first line of defense in the gut there, kind of the moat around the castle. More of an acute, the acute response there. The IgG is like once it gets into the bloodstream, that's the reaction in the bloodstream. So we're looking at both aspects, plus we're looking at the inflammatory component, the complement factor. So it just gives you a much more sensitive reading of the food, just opposed to the immunological response there.
yeah. And I think this test doesn't report them out separately, whereas some
It
tests
doesn't. It does not. No,
in
it does
like
it. It
separate
does it at the
columns.
same time. Yeah. So that's the differentiation there, is that it does it and it kind of factors in both of those in terms of the grading process of 0 to 4. So it takes into consideration the reactivity on both aspects there. Yeah.
Yeah. But she specifically was also saying her TPO antibodies were around 1,000 on LDN, avoiding reactive foods, working on gut barrier panel. But how common is this scenario in your practice that this reverses with just this protocol, short period of
Gotcha.
time that
Well, it
you're.
depends. I mean, like I said with this case, I think this was a more of an early onset of
Mhm.
the autoimmune process post-pregnancy. Um, and so we ended up catching it relatively soon. I did have access to previous labs of her previous labs, and her TSH was always hovering within the normal range, albeit it was a little bit on the higher range, probably in the 2 to 3 range. But after pregnancy, it hopped up to that 7, and we saw the her other doctors never ran antibodies, so I can't really comment on what the levels were pre-pregnancy.
Mhm.
I think that they more emerged after the pregnancy, obviously, because a lot of her symptoms, that's when a lot of these symptoms kind of came to light.
Yeah, for
So
sure.
yeah, 1,000 is high, obviously, and that's more of a situation where that it's been going on for longer periods of time.
Hmm. Someone asked in response to her question if she had done a stool test, but I think that's a good question for you is like, is this like the first step for the patient, or is this plus the stool test like the
I
amazing
will run stool
full
tests
picture?
oftentimes. I don't run it right out of the gate.
Okay.
I like to do one thing at a time, see kind of what's working,
Hmm.
um, save the patient a little bit of money if we can. And if I find that we're not making the progress 100%, I'll do a comprehensive digestive stool analysis to really take a good look at what else is going on in there. If there's
Yeah.
some dysbiotic bacteria, if there's parasites, oviparasites, and so forth. Yeah, how they're digesting their food, pancreatic elastase, and so forth. I like to look at all of those things. But this was kind of a neat case. It was like one of those slam dunk cases where you
Mhm.
do something, it works out. They're not all like this,
Yeah.
so as we
Yeah.
all know, but I like to highlight this one. This kind of showed really represented doing a complete workup, and
Mhm.
it's good for clinicians to see this in
Sure.
contrast to the conventional medical approach of just treating symptoms or just treating numbers on a page.
Right. Yeah. I had a similar case that her symptoms resolved really quickly it was eczema instead of thyroid stuff, but
Yes,
it was the gut barrier markers, the candida, all of that was high. And candida is so hard to see on a stool test too
it
that,
is. It
um,
is. You're right.
although the US biotech test is testing for a lot more strains now, so I feel like it's showing up more, but it is still one of those things that I feel like people sitting in front of you have thrush and then you're doing a stool test and it's still not on there and you're like, what is
Yeah.
going on? But I do also agree that like, in a perfect world, we might have the microbiome testing, but like a lot of the intervention that you're going to take from this is going to be the same intervention that you're going to take if you get that stool test and you see elevated inflammatory markers and you think
Exactly.
there might be, so just doing the one test can sort of.
Yeah, that's the beauty of it. And I feel that, you're getting a lot more information with this, and it kind of helps me kind of design my protocol a little bit better because we're
Mhm,
looking at so many different aspects here. And if you just ran a stool test without this, you wouldn't know what to tell the person to eat. You could say, okay, well, let's go on an anti-inflammatory diet, or let's go on this type, but you could
mhm,
still end up leaving certain foods in the mix that are part of an anti-inflammatory diet or an autoimmune diet that the person is reactive to,
mhm.
good foods.
Yeah.
So that's
Yeah.
why I mean, I tell patients, and I tell practitioners, this test really has revolutionized how I practice medicine. It's made it a hell of a lot easier for me instead of, the days of doing rotational diets with people and so forth, which no one likes, kind of a pain in the neck, but this makes it a lot easier. And patients are, they want to repeat it too down the road. And usually what I tell patients, they ask me, well, do I ever have to run this test again? I said, yeah, potentially. And I said, these are the instances where we would rerun it. If you have a
Mhm.
return of old symptoms, if you have new symptoms that have cropped up, so then we would run it again. Maybe we run it on a yearly basis. I had a patient just the other day who was doing fantastic. Quick story was my son. At a year old, he developed bad eczema behind his ears. So we ran the test, came back with more than about a dozen different foods. We were introducing foods to him and so forth. And I think a lot of the foods were foods that my wife is sensitive to. So he could have developed some of these food sensitivities in utero. And
Mhm.
so we ran the test and we took him off. Egg whites were at the top of the list, citrus fruits and so forth.
Mhm.
So we took him off the foods and his eczema cleared up beautiful.
Yeah.
Fast forward at 5 years old, symptoms came back with a vengeance. I said, okay, time to run the test again. So we run
Yeah.
the test. A lot of the previous markers that showed up originally, those were downgraded or not, if not eliminated, and some new ones popped up. At the top of the list, it was funny because it showed up olives. Okay, so olives were at the top. I said, olives? My wife goes, yeah. She goes, I'm feeding the kid. The kid's asking for salads. All of a sudden, he's loving salads. So she's putting like nice extra virgin olive oil on the salad.
Yeah.
She's loading it up with olives, and he's doing this
Yeah.
every single day. So
Yeah.
obviously, we needed to rotate his diet a little bit more. At this point, at 5 years old, I felt okay. He was able to swallow. I taught him how to swallow pills and supplements and so forth. So we did some gut healing, and he's 11 now, and he's doing really, really good. Unless he goes nutso with his diet, his eczema is well controlled, and as
Yeah.
well as a lot of other problems. So
Yeah.
yeah, pretty cool.
That's a good example. Someone had asked in the chat about using this in pediatrics. So it is available
All the
to,
time.
yeah,
Yeah, all the time. I use it. I do it all the time with kids, you know. The worst part is just trying to get blood out of their finger,
exactly.
you know, but we
There
play
is an
games.
option though that you can go to the lab and they can draw
Yes.
the blood. So some
Yes.
parents in my practice have chosen that instead of them trying to wrangle their child to do the
Yeah.
finger
But
stick
for the
thing.
most part, it's not
Mhm.
too hard. I'm able to, I can coerce them into give me their finger and let me steal a
Yes,
little blood from them. But
yes,
yeah, and the results come back and pretty impressive. I mean, with children, you see almost an immediate
mhm,
result too. I mean, it's just
yeah,
amazing. You know, these kids with always the snotty nose and they're always sniffling and snorting and whatnot and clearing their throat. That was my daughter. When we ran the test on her when she was young, she was the teacher called my wife and said, "There's something wrong with your daughter. It seems like she has a tick or something. She's always clearing her throat." Then, like, it was so common to us, we didn't really even pay attention to it. And then once I ran the test, we found that she had a raging dairy sensitivity. So we
mm,
took her off dairy, and lo and behold, that clearing of the throat, that
yeah,
postnasal drip, all went away completely. You know, and at one point she was having issues with hearing, so it was making her it was affecting her eustachian tubes and so forth. So, and she was having a hard time hearing, and the teachers were saying stuff saying that she wasn't listening. So, in cases of children with maybe that have been diagnosed with ADD or ADHD, it could
yeah,
be related to a food sensitivity that's contributing to hearing loss.
hmm,
So
yeah,
always put that on the radar. So kind of a cool one.
yeah. Yeah, and I think the addition, I mean, here of the gut barrier panel, like makes this stand out compared to other stool tests because I had a case of a guy with psoriasis that came in. He had done just an IgG test, removed the food, psoriasis went away, but there was no like look at his gut and what was going on. So he came to me like 2 years later when his psoriasis came back after he
Yep.
had seen that other provider, had it all in his eyelids, his arms, everywhere. And we ran the test. He removed the foods, but we saw the gut barrier pieces. We also did a stool test because of that and the extent
Yep.
of psoriasis that he was experiencing. So cleaned up the infection in his gut, addressed the food sensitivities, and now I see him out about in town and he looks fine. No psoriasis plaques all over his face.
Yeah. I mean, it could be that fast. I mean,
Mhm.
so what's the other option? Put them on a biologic. I mean,
Right.
that's the conventional route, and they say, you're going to be on this for the rest of your life. There's no cure for psoriasis. There's no cure for rheumatoid arthritis. There's
Yeah.
no cure for, that according to conventional medicine, there's no cure for autoimmune diseases. Well,
Right.
but we can put it into remission.
Mhm.
Yes, you're going to have that genetic susceptibility. And if you go back to doing all the things that are driving that autoimmune process, yes, it's going to come back out, but we can definitely tamper it down and put it into a remission state. And I see it all the time, all the time.
Yes. Yes. April had a question about is the app free? I think April's question was referring to the app that patients can use with their results.
Yes, it comes with yeah,
Yeah.
it does come with the test.
That's-
A lot of my patients, I do individualized diets with them anyway, so I don't really use too much of the meal plan that they provide. But it's
Mhm.
nice. It gives a patient another option. It gives you things to think about. I
It's not
I
super
use,
helpful
like I said,
in
what's
pediatrics.
that?
So it's not super helpful in pediatrics because the meals are like things that are more adult based.
Exactly. Yeah, yeah, exactly, exactly. So, but it gives you an idea, and then you have to educate. Then I educate the patient about where those things are found in foods and what to look for on labels and so forth. So there's a whole education there. And then I usually put a diet plan together from an individualized standpoint. Anyway, this just gives me another layer of how I'm going to plan out their diet. I do a lot of diet protocols with patients, obviously. I mean, that's a huge part of my practice. So yeah,
Yeah. I think the last question here, we sort of hit on already. If there's bugs or dysbiosis, leaky gut, wouldn't you want to rule that out first? So this test is looking at the leaky gut markers.
it's
But
looking at the leaky gut markers. It's looking at the candida. The candida control complex is kind of a broad spectrum type of antimicrobial, antifungal agent. So if there was no resolution of the gas and bloating and the IBS symptoms, hands down, I would probably run a stool test. This just test seemed to play out without the need for that. Or if I found that there was, still constipation or a lot of the gas and blood. Then we would rule out things like small intestinal bacterial overgrowth, and we would kind of go after either methane or hydrogen producing. Maybe we would do some testing, or we would just do a clinical trial of certain um, agents that would be specific for certain types of SIBO conditions. So I have different products that I'll use and I'll
yeah,
shuffle into the mix. And then in
yeah,
the end, we just kind of reestablish the bacteria with some good probiotics, some fermented foods and whatnot.
yeah. Awesome. All right. Well, I think that's a good way to close this out. But thank you so much for sharing today. And everyone, if you want to try this on yourself or someone in your family, or if your first patient that you want, you can go to KBMO, new to KBMO. And if you're already a KBMO provider, I think you can still use the discount for this particular
Yeah,
kit. So you can reach out to them and we'll follow up with an email as well with that information. So, hope everyone has a great weekend and we will have replays of this in your accounts next week as well. All right.
awesome.
Thank
Thank
you
you
so
everyone for coming on here on a Friday and listening to me talk all about my cases. So
much.
this is great. Thank you so much.
Awesome. Thank you. Bye.
Bye.